An opaque and often chaotic response to this outbreak. They left critical an opaque and often chaotic response to this outbreak. They left critical positions vacant in charge of managing pandemics at the National Security Council and the Department of Homeland Security. They left them vacant. They dismissed the people and never filled the slots. They were there from previous administration. The Trump budget called for slashing almost $700 million from the Center for Disease Control, and this was the budget which came out after we knew about the coronavirus threat. And now it continues to devalue our health needs by ransacking other public health needs, whether it's the Ebola fund or others. So that was up until now. Now, we are trying to work in a bipartisan way, and that's one of the reasons that I was delayed in meeting with you this morning. We're coming close to a bipartisan agreement in the Congress as how we can go forward with a number that is a good start. We don't know how much we will need. Hopefully not so much more, because prevention will work. But nonetheless, we have to be ready to do what we need to do. And in that regard, we want to make sure that the president cannot transfer any of these new funds. This is part of the statement from Chuck and me, from Leader Schumer and me. The president cannot transfer any of these new funds to anything other than use for the coronavirus threat, that we perhaps will have interest-free loans made available to small businesses which are suffering from the coronavirus. Some maybe have to shut down because of that. Vaccines, we must make sure that the vaccines are affordable, and we think it's important to make that point because of what Secretary Azar said yesterday. We would want to ensure that we can work to make it affordable, but we can't control the price because we need the private sector to invest. Really? This would be a vaccine that is developed with the taxpayer dollars to, again, prevent, and we think that should be available to everyone, not dependent on big pharma. I guess yesterday when the secretary made that ill-advised statement, he was wearing his pharma hat that he wore before he came here. And then we want to be sure that state and local governments are reimbursed for cost incurred while assisting the federal response to the coronavirus outbreak. Again, I spoke with the Vice President this morning, made some of these concerns known to him. We have always had a very candid relationship, and I expressed to him the concern that I had of his being in this position, while I look forward to working with him, about his, when he was governor of Indiana, slashing the public health budget and having some clinics, one especially a Planned Parenthood clinic, close, which was the only place where in that Scott County where you could get tested for HIV and AIDS. There was an outbreak. Again, he will have his side of that story, but the fact is that the health professional, the director of the health in Indiana at the time, Jerome Adams, was the vice president, then Governor Pence's state health officer. He is now the Surgeon General of the United States. So this is about resources. It's also about personnel. It's also about respect for science, for evidence-based decision-making. And it's about having so much of that talent that we are so proud of in our public health sector be available in other countries so that we can get a true and accurate assessment of what is happening in other countries. They may be having the best intentions, but they may not have, shall we say, even with the most talent they may have, they don't have the value added that someone from our country could lend. So in any event, we look forward, as I say, to working together in a bipartisan way, and hopefully, again, in a very candid way about our concerns about past performance or statements that are made. Let's put that in perspective as we move forward to have the adequate funding, the respect for science and evidence-based decision-making, and again, reimbursement for state and local government and understanding the impact that this has on our communities. And speaking of community, I had the privilege on Monday of having a walk through Chinatown. I always love to go there. I feel very proud of it. I always feel very privileged to and say, oh, my poor colleagues, then they come home, they don't have the advantage of this beautiful diversity that I have in my district. But sadly, Chinatown is being very hard hit by the lack of tourism and the rest of the coronavirus. So a number of us went there. Many press came too to see us go to a temple, light the candle, have a lunch, dim sum that was, go visit and make fortune cookies in the fortune cookie factory. By the way, fortune cookie machine, which is fabulous, is made in America, and fortune cookies are an American phenomenon. It's not something you really find in China, or at least it didn't begin there. In any event, in the shops and all the rest, to show confidence, not fear, in terms of the virus. So again, in every way, we want to be fully prepared, but not panicking or fearful of what is happening. Then tomorrow, on the floor of the House, we have very important legislation. It is to stop the youth tobacco epidemic that we're expressing. Also, it's on the public health front. The House will vote on H.R. 2339, strong legislation to combat the growing youth tobacco and e-cigarette crisis. More than 5.3 million middle school and high school students are using e-cigarettes, more than twice as many as 2 years ago. According to the U.S. Surgeon General, youth e-cigarettes use is an epidemic. The bill protects our children with strong measures preventing marketing to youth under 21, banning all flavored tobacco products, including menthol cigarettes and e-cigarettes. Big tobacco is just on its usual rampage. It uses flavors like gummy bear. Gun owners, because most of them have engaged in background checks. This would be only a simple matter of expanded to sales on the internet, issues that gun shows. The internet sales have come about more abundantly.
To coronavirus fears, and how much do you think that those market jitters should be taken into account, both here on the Hill and on the White House, when you are delivering messages about coronavirus?
Well, we are hoping to work in a bipartisan way to stop the spread, to have serious prevention, science-based, evidence-based decision-making with professionals who know the territory of science and epidemiology to do the job. The market dropped. Now it's 3,000, 2,500 as of last night. 3,000 is disturbing. But again, we want to instill confidence. We want to prevent without panicking people about this. But the market will do what it does with the invisible hand that it always does. It does show some fragility on the part of the market that it would drop so much. But again, it can't affect what we do if what we're there to do is to prevent and not panic people on the subject. A president said something so strange that you really have to wonder. He said the reason the market dropped is because unpledged delegates can vote for vice president on the first ballot. Just technicalities like reading of the rules. There's nothing, it's not political, and that's not, the rules say you have majority plus one. Yes, ma'am.
Last question.
You just said that it's your job to put forth an agenda that's mainstream, and I think I heard you say a non-menacing.
That's right.
And
that's how we win the House. I'm talking about the House of Representatives.
Right. And
yeah.
Your agenda, though, differs somewhat from Senator Sanders' agenda. You're not advocating, for instance, Medicare for all. So
that's
I'm
right.
Do you believe Senator Sanders' agenda is mainstream?
Well, I think that health care is the most important issue in the campaign. There are three issues: health care, and health care. That's why part one of our agenda and how we won the election last time was to lower the cost of health care by lowering the cost of prescription drugs. Second was to build bigger paychecks by building the infrastructure of America in a green way. And the third was cleaner government. On the first two, I think we can find some common ground to work with the administration on lowering the cost of prescription drugs. I hope so. Building the infrastructure of America. I hope so. Cleaner government, not so. But that's where we are. Now, it's not unusual. The support system in our country, the air our children breathe, the denial of climate and the rest, just time will take a toll. So it's absolutely essential that we win. Whoever the nominee is will have our wholehearted support. Unity, unity, unity. We've made a decision to win. Thank you all very much.
Thank you.